Hi, I'm Gene Liu and I'm an otolaryngologist, head and neck surgeon here in Los Angeles, and today I'm here to talk about removing ear tubes. When do we do it and what does it mean afterwards? Almost always when we put in ear tubes, they're going to come out on their own. The ear is generally really good at pushing out that little piece of plastic and closing the hole. Most tubes will come out on their own in about a year and a half. But once it gets to 2, and especially if it gets to 3 years of having been in place, we're going to generally want to take them out. In cooperative adults, this may be able to be done in the office, but in smaller children, this usually requires 5 minutes of anesthesia to get them asleep just so they can hold still. Taking out an ear tube is pretty straightforward. We reach into the ear, we grab the little piece of plastic or metal, and we tease it out of the hole that it's sitting in. The hole normally will close by itself without any further intervention, but if we're doing this in the operating room and somebody's already asleep, we'll take the added step of taking out the little rim of that hole or the rim of the perforation to facilitate healing and closure. Once the tube is out, there are a couple of different types of materials that are used to patch it like a band-aid. It acts as a scaffolding for the eardrum to heal and speeds up the process. Normally, after taking a tube out, the hole will close in a few weeks or up to a few months. Almost always, once the hole is closed, the ear is fine and nothing else needs to be done. On occasion, the hole doesn't close for some reason, and a bigger procedure may be required, though this is really rare. Immediately after the ear tube has been removed, whether or not a patch has been placed, most ENT doctors will suggest using ear drops for a few weeks. The ear drops are almost always made up of an antibiotic, and it's just to help to keep the ear clean and also help to potentially absorb the patch over time. When you're using the ear drops, it's very important to tilt your head, put in the drops, wiggle the outer part of the ear, pump the tragus, or this little triangular guy right here, to make sure that the drops get in. In the perfect world, you stay that way for a few minutes before you get up. And if you need to do the other side, then you just repeat the same procedure. As the eardrum is healing after the tube comes out, the last thing we want is for you to get a snotty head cold or a sinus infection during that time period, because all of the nose blowing and pinching puts a lot of pressure and can pop a hole where it's trying to heal or blow off the patch that we took all that effort to put in. Most of the time we will also recommend avoiding water activities. We don't want a lot of water getting in because sometimes that can disrupt the healing process, cause a little pain and discomfort and drainage. In that early healing process, it's also going to be a little bit stuffy or congested in the ear from the procedure, a little bit of swelling, perhaps the patch. We don't want you to get on an airplane or go through anything that gives you sudden and dramatic pressure changes. How long you need to adhere to these precautions depends on the technique used and the surgeon preference, so talk to your ENT doctor about it. In summary, what we want to do is, like always, try to avoid getting sick, but we also want to avoid a lot of significant high-pressure nose blowing, we want to avoid airplanes and dramatic pressure changes, and we want to use the drops if they're prescribed. I hope this video was helpful in what to do after an ear tube has been taken out. If you have any additional questions, please leave it in the comments below.